Elsewhere today, is healthcare law birthday day. It's first birthday. But instead of being served cake, it is now being served a lawsuit today. The group Crossroads Grassroots Policy Strategies suing the Department of Health and Human Services over its failure to release information behind the 1,000-plus page healthcare waivers, or 1,000-plus healthcare waivers handed out. We asked for the HHS for a statement. So far, we've not received one. This group that is looking into this, of course, is a group on which a lot of people have been focusing attention on the waste involved here, including the former White House counsel, Karl Rove. All right, Judge is here. What do you make of this?
Well, this is under the Freedom of Information Act, in which this group has sought to obtain from Secretary Sebelius information. And here's what they want. Who applied for waivers? What were the standards for which the waivers were granted? Who applied for waivers and didn't get them? And why did you deny those? These are all documents that are in the public domain, or ought to be in the public domain. And under a very recent decision decided by the United States Court of Appeals for the Second Circuit here in New York City, in which Fox Business was the plaintiff and the Federal Reserve was the defendant, the law is this information has to be coughed up. Now, once this information is coughed up and the public can see, why did New Jersey get an exemption and not Texas? Why did the UAW get an exemption and not the Teamsters? I'm just giving you examples. Why did McDonald's get an exemption and not News Corp? Then we will see that the government is violating the principle of equal protection. It is not treating people and entities equally. It's enforcing Obamacare against some and relieving others of their obligation to comply.
2014 is the year mandatory coverage has to kick in, right?
Right.
So are we still en route to that?
Yes. Yes, we are still en route to it, but there are a lot of building blocks to that have already begun to kick in. When I mentioned New Jersey getting a waiver, New Jersey is relieved of the obligation from putting together an extension of Medicaid to cover people who don't have health insurance but don't qualify as being in the poverty level. That has to be put together by New Jersey using its own tax dollars. New Jersey is relieved from the obligation of doing that now, along with 3 other states. The other 46 states have to start putting that together. So there are various parts of Obamacare that have started, that once people realized the burdens it imposed on them, they begged for waivers, and 1,100, we only know a handful, 1,100 of them got those waivers.
What does your gut tell you, Judge, on this whole health care law?
My gut tells me that the law of unintended consequences will devour this law, that it has imposed such a burden on small businesses, on labor unions, on even people that supported the president that really don't want to have anything to do with it. It is so burdensome, so expensive, so regulatory, takes away so much freedom, invades so much privacy. Here's a rule that started already. You go to your physician today and you tell the physician, I have this, that, and the other thing wrong with me. The physician puts it down in a laptop. Federal bureaucrats have access to what he put in that laptop. What about the patient-physician privilege? Gone under Obamacare. When did it start to go? When Obamacare kicked in a few months ago. I wonder if the public even knows that. This is the information that will come out once this Freedom of Information Act request is ruled on by a federal judge.
You seem upset.
I don't like it.
All right.
Did you have to guess at that?
No. I know he's going to be he's going to be all over this. He has been way ahead of the curve on this on Freedom Watch tonight. Thank you, young man.